Hi, my name's Lee Ianson, and you're listening to Paragon Skills Candour Conversations, where we have open and honest conversations about the care community at large. Today, I'm joined by Mark Moulding and Will Fenton from Skills for Care, and we're here to talk about the adult social care workforce data set. Mark is a senior strategic leader with a background as a BBC journalist and broadcaster, and Will is an experienced analyst of adult social care workforce data and the national minimum data set for social care. Thanks both for joining me today. So to start with, Mark, can you tell us a little bit about yourself, who you are and what you do?
Yeah, absolutely. I'm the head of policy at Skills for Care, which is the strategic workforce development body for adult social care in England. As you mentioned just now, I started out, which feels like a long time ago now, as a journalist for the BBC. In fact, I actually started out answering the phones for free on the weekends at the BBC just to get a foot in the door. But eventually moved into journalism, then on into various charities on the kind of external affairs and communication side of things. And I joined Skills for Care back in November 2022.
Brilliant. Quite a varied journey then. And the same question to yourself, Will.
Yeah, so I'm Will Fenton. I'm Programme Head for Analytics at Skills for Care. I've been at Skills for Care for almost 15 years, and I was around from almost right at the start of our data collection journey in terms of workforce data. And when I first started, it was all on paper questionnaires, and I've watch the service grow to now be an online service for employers. So day to day, I manage a team of 10 analysts now who are providing insights about the workforce.
Fantastic. Thanks both of you for joining me today. So we're here to talk about data. Now, being in marketing, data is something that truly excites me. What sort of specific types of data do you collect and analyse to provide insights into the care sector's workforce?
Yeah, so the adult social care workforce data set is our main collection tool that we use. So it's available to all types of adult social care employers. So for the whole sector, probably worth saying at this stage as well, it's not just a questionnaire. It's a service for employers. So they're putting data in, but we also make sure there's useful tools on there. I'm sure we'll touch on this later, that they can use to help them run their businesses. In terms of what we collect, so we collect information about the employers themselves, so what type of services they provide for, what care needs they cater for, how many staff they've got, the staff mix, and then recruitment and retention metrics, so how many people have left, how many people are starting, how many vacancies they're carrying. And then the employers then also go on to fill out data about their employees. We get a row of data per employee, so we find out about their demographics, pay and rewards, information about their contracts, how many hours they're working, if they're on a 0 hours contract, if they're permanent or agency, for example, and then information on the training and qualifications they've done as well.
So that's a hugely broad set of data.
Yeah.
And I understand you sort of support a huge amount of services, people like the government, Department of Health and Social Care, local authorities, the Care Quality Commission, planning, funding, monitoring the care sector. So what sort of ways do you help the sector at large?
Well, one thing I should start by saying is that we wouldn't have this rich data on adult social care that we do have if it wasn't for all the employers who contribute to the adult social care workforce data set and send us their data, which gives us so much insight into what's going on in the sector. And there are lots of reasons for why that's a good thing to contribute to. But one of those is the way we make the data available publicly for all sorts of good of the sector. So, for example, we put together annual reports based on that data. We did one in July this year, which looks at the size and structure of the adult social care workforce and sector. So that estimates things like the number of vacancies on any given day across the sector, the number of people working in the sector overall, and looking at things like international recruitment as well. We've got our big flagship annual State of the Sector report coming out in October, and that will look at a whole massive range of metrics and and give us all sorts of insight into what's going on in the sector, and things like demographics, pay, qualifications, as well as all that kind of supply and demand data that we put out in July. And those reports are used so widely. So you've probably heard a lot of people quoting the vacancy figure, which has recently gone down from about 164,000 to 152,000 on any given day. And that data is used by so many different people. So it's you'll hear it used by media all the time. You'll hear it used by people speaking at events. And we use it ourselves, obviously, as well. So those reports we generate and some of those really attention-grabbing stats are used widely by all sorts of people for all sorts of purposes. So yeah, absolutely. The Department for Health and Social Care sees our data. Leaders across the whole sector do as well, and that's why there are so many uses of it, and it can be put to all sorts of different types of use to really tackle the problems that the sector's facing.
Yeah, can I just add as well, Mark? It's one of the things we've introduced recently. We've started trying to show our data in a more visual way. So we're using Tableau software. So we've got a whole host of visualizations on the website, and the idea behind them is to make the data accessible to as wide of an audience as possible. So yeah, people can self-serve. They can get hold of the data themselves. They can drill down into the specific part of the sector they're interested in, whether that be a care homes or home care or a specific job role. And they can also drill down if it's local decision makers. They can go and look at a particular part of the country that they're working in or interested in. And those have been a really big hit. So we get hundreds of thousands of views on them of people who are self-serving and making use of the data that we make available.
I couldn't agree more. We ourselves have used your data in the past when it comes to one of the biggest struggles for the care industry being recruitment and retention. And having that accessibility is just so handy for us. You know, it's something that we can go in and just look at straight away, simple stuff. Having that further layer of accessibility with the new visuals, fantastic. It looks amazing. And if you haven't had the opportunity yet, go and have a look online for that. So when it comes to the quality of care provided by care providers, how would you say that your workforce intelligence contributes towards that?
Yeah, so like we said, like I touched upon earlier, there are benefits of providers being on the survey. So it's not just a questionnaire that they can complete. So especially thinking about your smaller providers, for some smaller providers, this is a free place for them to digitally store information about their workforce. So some providers use it for that. Again, for most relevant to smaller providers, we've put tools on there where they can enter the training and qualifications information, and it can give them alerts when certain bits of training are out of date. So a real tool for them to use. We've also recently developed on the service, we've got a range of benchmarks on there. So for employers that have entered their data, they can compare how they pay to organisations similar to them. So one's in the same geographical patch, delivering the same service, they can benchmark themselves in terms of how much they pay, what their staff turnover rate is, what levels of qualification their staff have got. Yeah, and we also know that in terms of workforce planning, organisations use it for that too.
So it's a broad scope. There's no two ways about it. And you said that really, really fantastic word there, free. So it's an accessible option that is free of charge for people to use, which is absolutely incredible. Have you got any success stories or examples of how your analytics and insights have helped care providers enhance their staff training and operations?
Yeah, absolutely. And we hear these all the time. But to give you one particular example of something we've heard, we spoke to a provider who looked at the report that they generated from our workforce intelligence data, and it was showing a level of turnover within their organisation that they just didn't quite believe. It looked so high that they thought the data was wrong. But then what they did is they went back and they looked through their own records, and they found out that the data that we were giving them, or they were getting from our workforce data set, was absolutely right. and they actually did have this high level of turnover that they just didn't realise. So from there, they were able to do all sorts of things to address that. They put a questionnaire in place to try and understand the experiences of new starters and what they could do to improve those experiences and therefore improve retention. And then they looked at things like pay as well. And they found that if they increased their pay a little bit, then that could potentially have an impact on retention of their staff as well. And they did all sorts of things like that, which the workforce data that we were able to provide them with really kick-started, and so they were able to sort of actively use it to improve the experience for their staff. They brought a new in-house trainer, for example, to help everybody through the care certificates, and they improved the offer of shadowing as well for new starters to help people settle in and feel more comfortable in their roles. So all that came from a statistic in the reports they generated from our data that at first the provider didn't believe, but actually turned out to be absolutely right, and they were able to act on that.
Yeah, I think that example, Mark, it really shows I can talk a bit more about how we do that. It really shows the power of the data we've got. So what we can do, because we've got data from so many providers and we've got a time series as well, we can anonymously, so we can't see what person it is, but anonymously track workers over time. So what we do with the data in terms of that is you take a cut of it a year ago, and then you can fast forward a year and you can see which workers stayed and which workers left. And that's really useful for understanding the patterns behind that and what factors play into retention. So we found out loads of interesting stuff. Workers who are paid more are more likely to stay. If workers are qualified and have been through training, they're more likely to stay. Some interesting things on demographics. So we're using all the data we've got from lots of providers to then provide insight back to employers. So we looked at their data and we said, here's how your workforce looks, and here's what we've learned from the data as a whole, to give them some personalized insights into what they could do to improve their business.
Incredible, invaluable even. I mean, having small businesses, specifically in the care industry, they don't have the funds behind them to go off and do that sort of research by themselves, and they might not necessarily have the skill base to look at that data. So to have that at your fingertips, like I said earlier, that's incredible. So you've mentioned there about the recruitment, the retention side of things. How does the Workforce Intelligence Service assist care providers in managing something like their training needs? Another aspect that helps keep a hold of staff when they're in place.
Yes, I touched on this before, but it's a really popular feature of AskWDS, especially for your small providers, that it's a place where they can digitally store their training and qualifications information. Got a stat here. It is one of the most used parts of the service. I think 40% of our page views are from employers using that training and qualifications section. We also do a survey when people sign up, asking why they're signing up, what the main reasons are, and that comes out as one of them, because they want this service. So what they can do on there, so once they put the training in, they can set up alerts for, say, if it's mandatory training like health and safety, things that expire and need renewing over time. It can alert them for which workers require which bits of training, and they can also define in the service as well which bits of training they consider to be mandatory for each job role, and then they can run off reports to see which workers have met those standards and which haven't. So it helps them create their training plans and understand their skills gaps.
So it's a really incredible way of actually refining your choices down to that finite sort of look of, I need to get this part of the training done. Let's have a look at what else is being done out there. This is mandatory. This is not mandatory. Oh, it's just brilliant. Absolutely brilliant.
Yeah, because we did some user research into that, because we asked users sort of, what for particular job roles, what training do they need? And there's no overall set standards, and different employers had their own view on what was mandatory and what was not for their organisation based on what they wanted to achieve. So there's that level of it's bespoke for them, so they can set it up, how it's useful for them, they can set it up like that. Something
else that the data set offers support in is the Workforce Development Fund, and how service helps care providers, how it can actually help them access this funding. So can you explain the importance of the Workforce Development Fund?
Yeah, so this is a prime example of how the adult social care workforce data set really gives something back to the employers who use it, because you need to have an AskWDS account to claim for the Workforce Development Fund, which is a fund that allows employers to claim back money towards the cost of their staff completing all sorts of qualifications for adult social care, as well as learning programs and digital learning modules. So when we've done sort of independent analysis of the fund, the results have been really positive. They've shown the quality of care that providers has improved as a direct consequence of using the Workforce Development Fund. And they've also reported things like feeling they can more effectively meet the specialised or personalised needs of people who receive their care and support, and also how the funds help them address skills gaps and even staff morale as well. So lots of positives as a result of using the Workforce Development Fund.
Actionable advice. We love it. I mean, yeah, those are all the key elements. I think sometimes people don't anticipate that something as simple as looking out for your workforce will retain that workforce. And yeah, no, that's brilliant.
Can I just say, I touched upon that about the data as well. That's one thing we can demonstrate using the data. By anonymously tracking workers over time, we can see that those employees where they've had investment in the qualifications and training, they are more likely to stay. So, yeah, real win-win, I think.
Now, you mentioned anonymous there, which yes, leads me quite nicely into the next sort of section there. So you've got places like Facebook doing all sorts of nasty things with people's data. So how do you ensure data privacy and security whilst handling the sensitive information about the care providers and their workforce?
Yeah, so in terms of the collection itself, well, we built it. We've worked with a trusted digital partner. They use state-of-the-art technology to make sure that all the communications via the internet is as secure as it can be. It's the same system used for internet banking. So really secure. We also take steps in terms of validating the users that are on there, and it all comes via our support team, and it's all checked out before they sign up, and it's all password protected as well. So that's in terms of the collection. So that's and then there's using the data as well. So the analysis team, so the people who work for me, they've all been through accredited researcher training with the ONS to ensure people are properly qualified and experienced and know all the things they should and shouldn't do in terms of GDPR. The data file we get, even internally, it doesn't list the person's name. It's a row of data. You don't know their name. We don't see their national insurance number or anything like that. So it's a row of data. So it's an anonymous file that we use. And as well, we do share the information with third parties, but that's done via secure data sharing agreements to make sure they're going through all the correct steps as well. And all the data we share with them is anonymous as well. You can't even identify the employer. They'll know it's an employer, for example, in Leeds that provides care home with nursing, but there's no identifiers in there to say which employer it is. And the same for the worker records as well. It's a row of data. You know, it's a worker who works in Leeds in a care home with nursing, but you have nothing to personally identify them.
It's always good to know that your data's safe. So we've got. So I'm a care provider. I've listened to what you're saying. I've thought about my own issues with retention. I've thought about my own issues with recruitment, and I want to get involved. What would your next steps be for someone that really wants to get involved in this?
Yes, they could. Yeah, head over to AskWDS website. You can sign up there. The service we built, it's been through extensive user testing to make sure it's as usable and as easy to use as possible. So the steps are really clear. So you'd head over there and start to create an account. We've also got our support team. The number will be on there if you did encounter any problems while you were trying to sign up. And they'd be happy to help.
Brilliant.
And it really is win-win as far as I'm concerned. It's contributing to the adult social care workforce data set has benefits for providers, and that data that we collect from them then goes on to benefit the sector as a whole. So it absolutely is worth doing.
You also mentioned that you've got something launching in October. Can you tell me a little bit more about that?
Yeah, absolutely. So this is our annual State of the Adult Social Care Sector and Workforce report. So it's a really comprehensive report that gets really deep into all sorts of sort of areas affecting the sector. So, for example, the size and structure of the workforce that we put some data out about quite recently. Also things like demographics, pay, training and qualifications. But when it comes to that report, Will is the absolute maestro because he's the man behind it all. So I'll let him tell you more.
Yeah. Will and team. I won't take all the credit. They do all the legwork. But yeah, basically we try and cover everything we collect. So we put as much information out as possible, and so there's top level things just like quantifying the sector and showing the trends in terms of recruitment and retention. But then we also deep dive into what are key issues at the time going on. So in the report that's coming up, we'll be talking about international recruitment, which we know has increased a lot this year. So we'll be really digging behind the detail of that and looking at the demographics of those people and how much they're paid, and trying to pull out and trying to show people any interesting insights there are. And we also, as well as using the data, we try and then link to anything else that's going on in skills for care. So if there's any more useful resources or further reading people can do. So it's a real sort of hub for the data, but then also everything else that skills for care do.
And one of the things that I'm really interested to see what we get this year is the percentage of men working in the sector and also younger people, because both of those groups are underrepresented in adult social care at the moment. So it'll be interesting to see what's happening on that front, because there is so much we could potentially do there.
Amazing. I mean, I've already started to see some of your stuff pop up over LinkedIn. So if you're listening, you're in the care industry, head over to LinkedIn, head over to Skills for Care and give them a follow, because there are some incredible resources coming your way. Huge thanks to Mark and Will for being guests today. I've learned a lot, so I'm pretty confident that our listeners will have learned a lot today as well. So thanks ever so much for listening to Candour Conversations. We really hope that you've enjoyed our deep dive into the adult social care workforce data set. And you can find out more information by heading over to skillsforcare.org.uk and simply search ASC-WDS. You'll find all sorts of useful resources, and that includes things like webinars, videos, and it will really help you to get started. That's all for this episode.